Hello everyone, Dr. Matt Ed. Today we'll talk about point-of-care ultrasound, ocular, and how to estimate intracranial pressure. We'll talk about how to perform ultrasound exam of the eye. We'll learn the ocular ultrasound anatomy and using the ultrasound to estimate intracranial pressure. Indications for using ocular ultrasound. You can use it if the patient is complaining of vision loss, change of vision, if they're complaining of eye pain, or suspected elevation in intracranial pressure, or if there's intraocular foreign body. Some contraindications include if there's actively bleeding and if there's blunt trauma to the eye. To perform the ocular ultrasound, you want to use a linear ultrasound probe, since that gives you a good view of the superficial structures. And the preset, set it to ocular or ophthalmic. And the depth is approximately 4 centimeters deep. First, I start in the transverse view, where the probe indicator points towards the patient's right, as shown in this image here. And then the sagittal view, where the probe indicator points superiorly towards the patient's head, as shown in this image here. I want to take a minute to go through the ocular anatomy, including the ultrasound. So here we have the cornea, and then right behind the cornea is the anterior chamber, and then here we have the iris and the pupils in between here. Then you have the posterior chamber behind the iris, and then you got the lens right here, and then you have the vitreous chamber, and the retina is the most inner layer of the eye globe. So coming over to the ocular ultrasound anatomy, here you have the eyelid, which is the most superficial, and then you have the anterior chamber. These are the iris, and then this is the posterior chamber, and this is the lens. Here is the vitreous chamber, and the retina is over here. The optic nerve is more posterior, and this is the optic nerve where there is an anechoic space, and you see that it's going down like that. When you get a good view of the ocular ultrasound, you want to make sure the anatomy looks normal. As in this video, this eye is completely normal. The whole globe is, here you can see that it's black, the vitreous chamber, and then there aren't any retinal detachments, and there are no hypo to hyperechoic structures within the vitreous chamber. And you also want to ask the patient to move the eye left and right, just to make sure that it stays intact and the structures still stay the same. Another information you can gather using ocular ultrasound is to estimate the intracranial pressure in a patient where you suspect they might have elevated intracranial pressure. And this is done by measuring the optic nerve sheath diameter, also known as ONSD. You do that in the transverse view. When you get the optic nerve sheath in the window, you measure 3 millimeters posterior to where the optic nerve sheath attaches to the retina. And then you measure the outermost lateral borders of the optic nerve sheath, which is the anechoic border. And if the ONSD measures less than 5 millimeters, that indicates the patient has a normal optic nerve width and a normal intracranial pressure of less than 20 centimeters of water. If the ONSD is greater than 5 millimeters, then you suspect elevated intracranial pressure, but we don't know how high. This is an example of the ocular nerve sheath measurement. You can ignore the yellow circle here, which just measures the circumference of the ocular globe. So when you get this view, you see this black shadow over here in the posterior area. You measure from here where the retina is, and you measure 0.3 centimeters posteriorly, and then you measure across from side to side where the anechoic space ends, and that gives you the optic nerve sheath diameter. So in this patient, the optic nerve sheath is 0.33 centimeters, which is normal. Recall, normal optic nerve sheath diameter is less than 5 millimeters or 0.5 centimeters. If you thought this video was helpful, please like, subscribe, and look out for my next video. Thank you.